What is an MSA? Let's go through the details in plain English. I'm Mark McClinton, founder of Senior Specialist Insurance. For 25 years now, we've specialized in Medicare health plans of every type. But there's some excitement surrounding these new Medicare medical savings accounts in Wisconsin. What are they? How do they work? And is it a good plan for me? Well, we're a leading producer of MSA plans, and we're going to answer these questions for you. We're going to be referencing the official CMS Medicare Guide for MSAs and the Medicare and You handbooks during this presentation. We have links on our website and our document library for downloadable copies, which have a lot of great information. An MSA is not an HMO. It's not a PPO. With an MSA, you can go to any doctor, any hospital in the country, so long as your doctors accept Medicare and are willing to bill the insurance company. It's very much like having a Medicare supplement in that regard. Now, if you currently have a Medicare supplement plan and you want to know if it makes sense for you to consider an MSA, what you should do is add up how much you are currently paying for your Medicare supplement. Add it up for the whole year and keep that number in mind. Now, maybe you currently have an HMO or a PPO Advantage plan. How much is the maximum out-of-pocket limit on that plan? If you don't know, maybe you want to pause this and go look it up, but keep that number in mind. MSAs are really not difficult to understand. There's a little bit of a learning curve, but once you understand how they work, they are in fact quite simple. I'm going to take 90 seconds to explain the plan in a nutshell, and then we'll go back and go through the details using different examples. For starters, you have no monthly premium. There are two parts of an MSA. There's a deductible and there's a deposit. Now, these two numbers can be different depending on the insurance company, but let's say your deductible is $4,500. That means you pay 100% of all Medicare Part A hospital and Part B medical expenses until you meet the deductible. If you meet the deductible, now the insurance company kicks in and they pay 100% for the rest of the calendar year. It's really that simple with just one extra little feature, which is the deposit. But let's just start off by thinking of it that way. You pay 100% for the first $4,500, they pay 100% after. Now that part by itself, it doesn't sound good. My Medicare supplement, I never get a bill, right? I hear it all the time. Why would you want a plan like this? Well, here's where things get interesting. The insurance company deposits $2,500 from Medicare into an account set up in your name, which is your money that you use to pay for any medical-related expenses. This is not a deposit that you make. This is money that comes from Medicare, a government program that you've paid into your whole working life. So, you can use this money to pay toward your deductible. And that leaves you with a maximum out-of-pocket of how much? Now, let's do the examples. First, you've enrolled into the plan. You go to the doctor for the first time. You show your card from the insurance company, not your Medicare card, because remember, this is a Medicare Advantage plan. You don't pay anything up front. There are no copays. So, you go in for a routine exam. The doctor does a blood test, a cholesterol check. Let's say you had a slight fall last month and your shoulder is still bothering you. So they do some x-rays or various things of this nature. The doctor's office sends the total charges to the insurance company. Let's say it's $1,800. The insurance company receives the charges, and those charges get adjusted to the Medicare fee schedule, and they knock that bill down to the Medicare approved amount. Now, if you've never paid much attention to these statements, I recommend that you do, because when you're on Medicare, it's amazing in most cases how much the bills get reduced. If your doctor accepts Medicare assignment, then he or she will accept the approved amount as payment in full and write off the difference. If not, The MSA will still cover the excess charges, which we will talk about more in a minute. Most of you should be familiar with Medicare assignment, and your doctor should be accepting it. Now, the approved amount, it might be $800. It might be more, it might be less. The important thing to know here is that this is the amount that goes back to the doctor's office, and this is the amount that you will be billed from the doctor. That's the amount that you pay with your deposit money. You get out your MSA checkbook, write out a check, and send it to the doctor's office. 6 months goes by, and you have another routine doctor visit, except this time there's no complications. They send the charges to the insurance company. Let's say this time it's $500. The approved amount, $200, give or take. So this time you pay $200 out of your account. Your total amount spent out of your account for the year is $1,000. You have $1,500 left over. Now, it might be more, it might be less, but this is a common example I see all the time. What happens to that $1,500 left over at the end of the year? It rolls over and is added to next year's deposit money. So, you build this account up from year to year. What happens if you decide you don't want to stay on the plan for next year? Do you lose the money? No. It's your money. Let's say you sign up for a different plan next year. You can use the money to pay co-pays on the plan you enroll in next year. Or you could use it to pay a dental bill 2 years from now, 10 years from now. It's your money. Now let's talk about a worst case scenario. You've probably done the math already. Let's say you had a triple bypass. Let's say you have ongoing chemo. You get hit by a truck. You're in the hospital a week, a month. Now you're going to burn through that $2,500 pretty fast, right? Now you're paying everything out of your pocket. The bills are piling up, $100,000 or more. There are no limits on how much is paid by the plan. So what is it going to cost you out of your pocket for any major catastrophe? $2,000. You've hit your deductible. Your cost, $2,000. Remember that premium you're paying for your Medicare supplement? How much was that for the whole year? Are you on an HMO? How much is that maximum out of pocket? $3,400? $6,700? Okay, now we're talking about a bad year here. But let's go back to the average year. You saw the doctor once or twice. Throw in some diagnostic tests, x-rays, lab services. You might spend $500 to $1,000 out of your deposit money, which means you have $1,500 to $2,000 left over. The point is your Medicare supplement going to pay you back because you had a good year? No, it's not. Stop paying for a bad year every year. Now, why have I not heard of this before? Okay, it's January of 2017, and there are only 3 insurance companies in the country that offer these plans, and 2 of them just happen to be in Wisconsin. 2015 was the first year either of these companies offered a plan, and they only offer their plans to residents of Wisconsin. Now, I'm not sure if this is just a coincidence, but we've been offering Medicare products for both of these companies for about 10 years. We happen to be geographically located in central Wisconsin between these companies. If you live in Wisconsin and are on Medicare, you and I are both very fortunate. If you don't live in Wisconsin, you are very fortunate it's not 10 below zero. Sorry, it's been a little chilly out lately. What is a Medicare Advantage plan? Very important. A Medicare Advantage plan is a plan offered by a private insurance company that has a contract with Medicare. Medicare pays the insurance company to administer all your Medicare Part A hospital and Part B medical expenses. Most of the time, the Part D is also included, but not in the case for an MSA. And that's a good thing, and I'll tell you why in a minute. Okay, but now you have the insurance company paying instead of original Medicare. Advantage plans must cover everything that is covered under Original Medicare. There's many insurance companies that offer Advantage plans, and the plan designs vary depending on the company and can be different county by county. Some people refer to these as copay plans. So where Original Medicare has a set design and generally pays 80%, Advantage plans have different dollar amount copays depending on the specific medical service that you receive. In this case, it's a flat deductible. There is no 80%. There is no 20%. All Medicare charges go toward the deductible, including preventive and wellness exams. The MSA that we're talking about here is quite different and unique than all other Advantage plans. Other Advantage plans come in the form of HMOs and PPOs, where you have to stay within a network of doctors and hospitals. MSAs have no network. I said this earlier, but this is very important. You have the freedom to choose your doctors. Any doctor that accepts Medicare is covered by the plan. All the doctor needs to do is bill the insurance company. Now let's talk a little bit more about this deposit money. How exactly does that work? After enrolling in the plan, you will receive a checkbook and a debit card in your name. The checkbook and debit card are tied together into the same account, which is set up by the insurance company with a bank that specializes in these types of accounts. You cannot add your money to it. You can either use the checkbook or the debit card to pay the bills as they come in. Now, this is IRS tax-qualified money that can only be used for medical-related expenses. What does that mean? Dental, glasses, hearing aids. Have you ever had a shingles shot? Charges that Medicare doesn't even approve. You can use the money to pay copays and deductibles on your Part D prescription drug plan. Now, you cannot use the money to go out and buy a new TV or groceries or things like that. If you do, you will be taxed 50% on this money. Don't do that. You cannot use the money to pay insurance premiums. Now remember, there is no premium on the MSA, but standalone Part D drug plans do have a premium. I need to spend a minute talking about what expenses get counted toward your deductible and what expenses do not get counted toward your deductible. So even though I said you can use the deposit money to pay for things not covered under Original Medicare, only things covered under Original Medicare count toward the deductible. If you spend this money on things that are not Medicare Part A and Part B charges, then you will have that much more to go before you get to your deductible. So when I say your maximum out of pocket is $2,000, that's only if you use the deposit money for Part A and B charges. I encourage you not to be thinking too much about spending all the deposit money for dental or hearing aids until you've been in the plan for maybe a few years. Give that account a chance to build. Now, it's your money to spend the way you want, but that way you won't get hit unexpectedly with the full deductible at some point later. I have many clients that are in their third year now and have been to the doctor very little, a few not at all. Their account well exceeds their deductible. And although nobody knows when something's going to happen, if you're a healthy person, an MSA might make a lot of sense for you. Who keeps track of this deposit money? You do. Does the insurance company keep track of the deposit money? No. What if you spend all your deposit money for a vacation? I said before, don't do that, but this example makes it a little clearer how the plan works. The insurance company doesn't know how you use this money. You could even say they don't care. The point is, the insurance company is keeping track of one thing only, the $4,500. That's when they start paying. If you decide to pay the whole $4,500 out of your own pocket and let the deposit money sit there and build up every year, They don't know, and they don't care. Is there any good reason to do this? No, not really. It's there to be used for medical expenses, so you may as well use it. Now, let's go back to excess charges for a minute. The majority of doctors agree to accept the Medicare-approved amount as payment in full. This is called accepting Medicare assignment. However, there are a few doctors that may balance bill up to 15% over and above the Medicare-approved amount. Now, this 15% is also called the limiting charge. I'm going to use Mayo Clinic as an example because this is where I see it happen mostly for people in Wisconsin. Okay, so the clinic will bill for services rendered in the amount of, let's say, $1,000. The approved amount, $500. But the clinic doesn't accept assignment. So they can balance bill up to $75 more in this case, 15% of the $500. Now, original Medicare doesn't cover the 15%, and it would only be covered on a Medicare supplement if you have the excess charges rider. The Centers for Medicare Services has clarified that MSA members are protected from balance billing, which means that if you run into this situation, the excess charges are applied to the deductible and covered after the deductible. Next topic. MSAs do not include a Part D drug plan. Almost every other Advantage plan, because it's an HMO or a PPO, you must take the Part D that's included with that plan, right? Well, how good is the formulary? Is my drug covered? How much is my copay? What if you could choose your own drug coverage? Well, there are over 20 different standalone Part D drug plans in Wisconsin for 2017. Premiums as low as $17 a month. Average premium maybe $35 a month. The reason for all these standalone drug plans are mostly for people that choose to stay with original Medicare. There are very few other exceptions, and one is an MSA. Part D formularies and copays vary a lot. One example I see quite often. Okay, you're looking at a certain Advantage plan, but they have one of your drugs in Tier 4 with maybe a $100 copay. But there's a standalone drug plan that had that same drug in Tier 3 with maybe a $26 copay. The savings is substantial enough that now you got to find a health plan that can be paired with that standalone drug plan. What does that leave? Medicare supplement or MSAs. Do you have a long list of nothing but generic drugs, but still have a deductible? Maybe one of those drugs is in Tier 4, even though it's a generic. More than likely, there's a standalone plan that has all those drugs in Tier 1 or Tier 2 with a $0 copay or maybe a $4 copay and no deductible. We will help you find that plan if it's available. Now, standalone drug plans also offer more flexibility. If you have a new drug not covered on your current plan, you can shop every year. You can switch drug plans without touching your health plan. MSAs, because it's not an HMO, because it's not a PPO, you can pair that plan with a standalone drug plan. By the same token, if you like your standalone drug plan, if you switch from a supplement to an MSA or vice versa, your drug plan is untouched. And that leads to our next topic of conversation. When can you join an MSA? The enrollment periods for MSAs are more limited than any other type of plan. Every year between October 15th through December 7th, you have the option of enrolling into an MSA. This is the annual election period, or AEP. There is only one health question you must answer if you want to enroll. Do you have end-stage renal disease, kidney failure? What about going on Medicare for the first time? This is called the initial coverage election period. You must be on both Medicare Parts A and B to enroll into an MSA. Some people who are on a group health plan through an employer will postpone their Part B while they are on that plan and then enroll in Part B later when they leave the plan. You can sign up for an MSA up to 3 months prior to your Part A and Part B start dates, or your Part B start date if you had Part A before. Your coverage will start on the first day of the month that you have both Parts A and B. Medicare allows for certain special election periods to join a Medicare Advantage plan. There are no special election periods for MSAs. For example, if you move to Wisconsin, you must wait until the AEP to enroll. You cannot enroll into an MSA if you are on Medicaid or receiving hospice care. You cannot enroll into an MSA if you are on TRICARE or receiving any VA benefits. If it's the first time in your life that you have joined a Medicare Advantage plan, you have a 1-year trial period to leave that plan and return to original Medicare anytime during that first year. Now, if you have enrolled into an MSA and you leave that plan for any reason during that year, you will need to pay back on a prorated basis a portion of your deposit money. I have a few examples if you want to pause the video. A common question: what happens to your remaining deposit money upon death? When you sign up for an MSA, we list a beneficiary or beneficiaries that will receive your account balance. If you are coming on Medicare for the first time or leaving your group plan in the middle of the year, your deposit is prorated by the number of months depending on when you join. Then in January, you get the full deposit for next year. What about the deductible? The deductible is also reduced by the number of months you are on the plan. Annual notice of change. Every October, you will receive your annual notice of change. Will your deposit money and deductible be the same for next year? Will there be increases? Will there be decreases? This is based on the insurance company's loss ratios. The insurance company sets the deductible and Medicare sets the deposit. You receive this notice prior to the AEP so that if you want to shop around for next year, you can see if there is a plan that better fits your needs. Okay, let's wrap it up with a few more details. Foreign travel. MSAs do not cover outside the United States, Canada, Mexico, overseas. If you want coverage, you can purchase a separate policy to cover you for the time you are gone. Nursing home. Original Medicare requires a 3-day minimum prior hospital stay before you can be covered for recuperation in a nursing facility. This requirement is waived on MSA plans. And this is getting to be a bigger concern over the last several years as hospital stays seem to be getting shorter. More and more people are getting stuck with these bills, which can be substantial. Original Medicare will not cover you for your recuperation in a nursing home if you have not met the 3-day minimum hospital stay requirement, which means that a Medicare supplement will not cover either. With an MSA, you can go directly into a nursing home without any prior hospital stay and it's covered, so long as you meet the Medicare criteria for medical necessity. Well, thank you very much for watching. I hope you found this informative. My name is Mark McClinton, founder of Senior Specialist Insurance. If you have any questions, feel free to call us 1-800-817-8683. We're happy to send out more information. You're welcome to stop at our office or make an appointment, or you can send us an email at the email address below. Have a great day.